What are the pros and cons of having microdiscectomy? Hi, I'm Dr. Ruth the Pain Doc, founder of Chronic Pain Rescue, a telehealth practice dedicated to helping those who suffer from chronic pain to live pain-free or significantly pain-less lives and to live their best lives. I'm bringing this actually in some of my other posts, this information, but someone just reached out with this question: should I have microdiscectomy? My doctor's recommending it. So I just wanted to put some information out there for that particular person, but also to anyone that's considering it. If you've had pain at least 3 months, which again is the definition of chronic pain, and you've tried other alternatives and they have not worked, then yes, if your surgeon is recommending microdiscectomy, it probably is a good idea. Always get a second opinion. And I don't mean by me who's not seeing you, someone who's actually seeing you in real life. But what are the pros to microdiscectomy? First of all, it's less invasive than other types of surgery in this vein, and therefore less risk. Less risk of bleeding, less risk of infection. It's a fairly quick procedure. It's quicker recovery time. Sometimes they'll let you go home the same day, or maybe keep you overnight and you go home the next day. Quicker recovery time. In 6 to 8 weeks, you should be able to get back to work. If your pain is predominantly in your leg or your limb, it's 80% success rate. It's definitely more successful when a person has limb pain versus their pain is in their spine. But even with the pain being in the back, that's a 77% success rate. So it's not bad. So as I said, it can be very, very effective and less risk of complications and quicker recovery. What are some of the cons? Of course, no surgery, nothing invasive is totally without risk. There still is a risk of bleeding. There is a risk of infection. There's a risk of pneumonia. There's a risk of spinal fluid leaking. There's a risk of numbness or weakness as a result of nerve damage from the surgery. And there's a risk of blood clots. And there's risk of loss of bowel or bladder function. Of course, that's usually temporary, but there is that risk. And there's a significant risk of having to undergo surgery again. Call it the next level, call it syndrome, but often once you've had surgery at one level of your vertebral column, the next level degenerate, and your risk of getting a herniation at the next level, having to have another surgery. I wouldn't recommend doing that more than once. I've heard of people having 3 and 4 spinal surgeries. I just wouldn't recommend doing that. But so those are things to consider. As I said, always get a second opinion and make sure they tell you what are your options. What else could you do if you don't have microdiscectomy? There was a case I was referred to me as the physical medicine doc to send this young woman who had a herniation in her neck. Her cervical spine was sent by the surgeon for a trial of therapy to see if it would help, and he told her not to take any pain medication at all, to see if the therapy alone got rid of the pain. And of course, in a month's time, when she saw him again, she was crying for the surgery. I thought that was a travesty. I felt I couldn't say anything. This was someone referred to me. Now, I'm not the treating physician. They're the treating physician. But to tell someone to not take anything for pain, nerve pain, pinched nerve pain, radiating pain, it is a terrible, terrible pain. Of course, you need to take pain medication. The therapy can work, but it may not work in the first couple of weeks. You need more than just the therapy. Anyway, so if they tell you what are your other options, as I said, exhaust your options, because surgery is serious. It is invasive. There is a risk. But if you have to do it, then certainly you should do what you need to do so that you can feel better. Hope that helps. And until next time, peace and blessings.